Hello, I'm Cyril White, head coach and one of the owners here at Country Spirit CrossFit. And in this video, we're going to discuss a disease, a condition that many young athletes get, especially athletes that are taller and play sports where a lot of jumping is required. It's called the Osgood Schlatter disease. This is my daughter Nina. She's going to be a sophomore this year in high school. She's on the varsity volleyball team, obviously, because she's a good volleyball player and she's very tall. So she's grown, along with a lot of her teammates, has grown very fast in a short amount of time, and her muscles and ligaments and tendons have not had enough time to catch up in their strength to this growth. A lot of times we see Osgood Schlatter's disease in a lot of athletes that have just grown really fast and that have to jump a lot. What Osgood Schlatter's is, if you could put one of your knees up here, Nina. Luckily, she does not have it yet, hopefully because of our good coaching. But what you'll find on many of her teammates, they'll develop a sharp, pointy, extra bone here on their knee. They'll actually get a point. Luckily, she does not have it, but it'll be a pointy, sharp bone that's very sensitive to the touch and very painful. And the reason they develop that bone is because the ligament that connects the shin to the kneecap is not as strong as the muscles that are connecting the quad to the kneecap. So the body tries to overcompensate because of that imbalance, and it grows extra muscle there. It becomes very painful and very difficult to jump. They're not sure why exactly the one reason that Osgood Schlatter's is caused, but they do know that it happens in kids that grow very quickly, kids that are involved in jumping sports, and kids that have poor jumping technique and lack of strength in their muscles of their legs that are used for jumping. So what we're going to cover are some techniques, some strengthening techniques, and some techniques for stretching and jumping that'll hopefully prevent Osgood Schlatter's. And if you have it, the stretching techniques will hopefully make it go away. It can go away in some people in a couple of weeks, but it can last all the way up to 2 years depending on the condition and the severity of it. So first thing we're going to cover is the air squat. The squat is probably, if I had to pick one exercise, if I could only pick one exercise that I could do for overall fitness besides running or any cardiovascular exercises, it would be the squat. It's the best all-around exercise. Why? Because our legs and our butt, our glutes, are our biggest muscles, and they're our strongest muscles typically, and all of our power comes from our hips because that's where our biggest muscles attach. So if we can properly strengthen our biggest muscles, our hamstrings, our quads, our glutes, our lower back, which is what the proper squat does, it's going to just make my overall fitness of my entire body that much better. But you have to do squats correctly. When I first started training with a coach and hired a coach, I had been running. I was a triathlete. I completed an Ironman triathlon. My knees were just about shot, and I hired a coach, and he brought me in, and first thing he had me do was start doing air squats. And he said, we're going to do a lot of squats because it's good for us. And I said, I can't do squats. My knees are almost shot. When I run, it hurts. But that's because I didn't know how to do squats correctly. He showed me how to do squats correctly. We did a lot of squats in our workouts, a lot of different kinds of squats. And it just made my knees I'm talking about a late age, 40 plus years old, made my knees that much better. Knee pain went away, and that's because of the squat. So, but again, you got to do it correctly like anything else. So Nina's going to step up on the box, and we're going to demonstrate the proper cues for a correct squat. And this is if you're doing a body weight squat, which we call an air squat, which is perfectly fine, especially for young athletes. If you're doing back squats, front squats, overhead squats, whatever kind of squat you're doing, these cues are what you need to be doing. It doesn't matter what type of squat it is. These are the cues that you should be doing on every type of squat to make it correct and to properly balance and strengthen all of the muscles and tendons and ligaments around your big muscles and your strong muscles of your legs. So first thing she's going to do is make sure that her feet are just outside shoulder width. Her toes are going to be pointed out at a slight angle. As she gets better mobility, meaning as she can properly squat down with all the correct form, she can start bringing her feet in at a less extreme angle, and that'll help improve her mobility even more. But at first, when we're just learning how to squat, when I first started to squat, I could get down to about here, and it was extremely painful. That's because I did not have the proper mobility, because I wasn't squatting, I wasn't stretching, I was just pounding my body into the ground. I had to have my feet at extreme angles to get down as low as I could get. The reason we want to squat down and get down as low as we can get, preferably getting that hip crease just below parallel of the knee, is because that strengthens both our quads and our hamstrings. If we're only squatting to here all the time, the primary load is on our quads, and that's part of the problem with Osgood Schlatter's disease, is that if these are not stronger, but the rest of our legs are not getting stronger, and that ligament between the kneecap and the shin is not also getting stronger because I'm not using full range of motion, then that's going to create imbalances, and that's going to create problems and diseases like Osgood Schlatter. So, feet outside shoulder width, toes pointed out slightly. She's going to interlace her thumbs down by her waist, and the first thing she's going to do is push her hips back. Reagan, my other daughter Reagan, is doing the filming. Thank you, Reagan. She's going to push her hips and her butt back that way. Like she's going to try to sit in a chair a little more. Even Nina, push that butt back, okay? That's the first thing we do when we squat. Why? That keeps our knee from going over our toe, which is very important. Then she's going to squat down and lift her hands to keep her chest up, trying to get that hip crease below her knee. She doesn't have the mobility yet, but from doing a lot of squats, she will get there. Very important to keep that knee from going over the toe and to push that butt back first. All right, stand up. Reagan, let's show from the front. The other very important thing when we're squatting is to push the knees out laterally. What I mean by laterally is, she needs to push her knees out that way, okay, when she squats. So butt and hip back first. Push those knees out so you're touching my hand. Up, down. Her knee should be in contact with my hand the entire time. Up, down. Pushing those knees out into my hand. That's part of the problem with improper jump technique, is if we're not pushing, if the athlete is not pushing those knees out, if my knees are caving in when I jump. So let's see Nina's knees when they're caving in. We just did a film of Nina jumping, and what you'll typically see with young athletes is, especially tall ones, when they jump, this is what happens. Their knees go in. That's one of the things that causes this Osgood Schlatter's disease, is because the knees go in and it's improper jumping technique. That weakens that ligament. The knees are going in because my muscles and ligaments around my knees are not strong enough, and that forces an imbalance. The knee should always go out. Let's see knees going out, even just slightly when I jump. Okay? So pushing the knees out, that's very key. In our next video, we're going to cover, thank you, Nina, some stretches and other mobilization techniques that you can use to hopefully prevent Osgood Schlatter's or cure Osgood Schlatter's disease. Thanks. Train hard and stay safe.